I'm Kelly from North Shore Eye Care. Today I'm sitting with Dr. Gerri Competiello. She's an audiologist here at North Shore Eye Care, and we are going to be discussing the relationship between hearing loss and cognitive problems. Thank you for sitting down with me and taking time out of your day.
Thank you.
So, according to the Hearing Loss Association of America, hearing loss affects 48 million Americans. And there's a definite risk for cognitive problems such as dementia. So I wanted to hear what Dr. Competiello had to say about it. She definitely has been in this industry for a while and knows quite a bit about this topic. So first off, what studies have been performed, or what can you tell me about the research that's been done on this?
So there has been a lot of research being done on this and have been done on this particular relationship or correlation between hearing loss and cognitive decline. One of the most recent studies was done by Dr. Lin, who is a neuropsychologist in Johns Hopkins, where he looked over 11 years of patients that were over the age of 65. And that particular study, not only did they do verbal testing, but nonverbal testing as well, to see where that cognitive decline was. What that study showed over the 11 years of these particular patients is that people who had hearing loss actually had a faster decrease in cognition than people that did not have hearing loss. That then got backed up by a researcher in France stating the high correlation between cognitive decline or memory and other aspects, possibly Alzheimer's and dementia, and the correlation of hearing loss. So when you're not hearing it, you're unable to retain it. And by unable to retain it, then we're not using those neuroplasticities of the brain, and sometimes those neuroplasticity pathways get reassigned to other aspects of the body. So unfortunately, just like everything else in our body, if you don't use it, you lose it, with hearing and especially with clarity.
Right.
More importantly, with hearing loss, we're dealing with nerve fibers. We're not dealing with muscle fibers. So today, we're in the holiday season, and we may put on a couple of pounds. But once those holidays are over, we go to the gym and we work out those muscles, and those muscles become vibrant and strong again. However, once the hearing loss actually sets into play, that area of the nerve, what brings the information up to the brain to be processed, starts to die off, and that's called auditory neuropathy. Once it dies off, it is not possible to get it back, because unlike other mammals out there, humans do not regenerate nerve fibers.
So what would be the process for diagnosing somebody with hearing loss and cognitive?
That's a great question. The prognosis or the diagnosis of hearing loss has to kind of change a little bit. Just like everything else in our bodies, we get annual checkups. We get a well visit checkup every year and get our vitals checked, our cholesterol, all of that. We get our teeth checked annually. We get our eyes checked annually. One thing that is not being checked annually is hearing. And regardless of the age, whether they be 2 years all the way up to 99 years, you should have this sense checked annually. And it's just like a child that goes into early intervention because of articulation errors or maybe language problems or something along those lines. The sooner that it's diagnosed, the easier the prognosis is, and the quicker that prognosis becomes. Same thing with hearing loss. If we're checking these people for hearing loss every year, you may not have a hearing loss. If you start in your 20s and then probably in your 60s, you start seeing a little bit of a change. At least we can kind of nip it in the butt, per se, right off the bat, rather than waiting 20 years with some type of severity of hearing loss and then saying, you know what, mom and dad are just not picking up as well as they used to be, or they're just not hearing me, and they're coming in a little bit late in the game to get help with that. And unfortunately, at that point, then, the cognitive decline is already starting to set in. So I would say it would be more of an earlier diagnosis for hearing loss. And the only way really to do that is to get checked annually.
So why do you think that people are not taking it so seriously and they're not getting their hearing? Do you think it's just that they feel like it's a minor hearing problem, that they're not having it affect other areas of their life?
No, actually, I don't think it's a minor problem. I think it just happens so gradually.
Right.
You know, if you woke up in the next day and you weren't able to hear the water running or your children screaming down the hallway or something along those lines, you would be in an audiologist or an ear, nose, and throat doctor's office immediately.
Mm-hmm.
But because this happens so gradually over 20 years, 15 years, and then it's not even what they remember how to hear.
Yeah.
And many times patients will say, oh, well, they're just speaking lower, because that's what they they don't remember hearing at the level that they should be hearing. Many times it's their third party or their spouse, their loved one, their children that are saying, I really think it's time for you to get a hearing loss. So I think it's just because it happens over such a gradual process that they get acclimated to it.
Regarding cognitive issues, so if a patient does come in and have their hearing checked, is this something that can be reversed? Can it be improved?
Unfortunately, hearing loss can never be improved.
But what about the
cognitive decline can, there's still research out there that's saying yes, no, or indifferent right now. The verdict is still out. What I feel personally is that when a person does come in with hearing loss and they start getting that stimulation again with the help of hearing devices, then their cognitive level would probably either maintain or improve a little bit. And that's what we're looking for even when we're testing people for hearing loss. It's not so much the nature or the degree of the hearing loss, but the clarity, the ability to understand the words like box versus fox.
Mm-hmm.
When that clarity is there, the severity of the hearing loss can drop significantly. However, as long as they're getting stimulation to the brain, which is our processor, that's what we understand speech from sound and environmental sounds versus, important information coming through. As long as that's still being aidable and as long as that's still being stimulated, that's where we're trying to focus on. It's not so much treating the hearing loss, but maintaining that ability for that brain to process sound as it needs to. And I think with the help of hearing devices and hearing loss and being diagnosed sooner, then cognitive decline would probably slow down.
Right.
So that's
stopping the progression.
Stopping the progression.
Right. The hearing loss and the cognitive decline.
Your hearing loss could definitely get worse, but that clarity ability stays the same. So when we test patients, not only do we look at tonal stimulus, but we also look at the word recognition scores. And if those word recognition scores are, let's say, 80% and they get fit with hearing devices, a year later when they get their hearing tested again, those tonal stimuli may drop maybe 5 or 10 dB. However, those scores of clarity, those recognition scores maintain. And that's ultimately what we're trying to do, is keep that brain and feed it what it needs.
Great. Is there anything else that you want to add about this topic?
Keep looking out for it. It's a very hot topic, not only in the hearing industry as well as other medical aspects, and it's also a very hot topic in a couple of different magazines as well as health magazines. So you'll start seeing a lot more research being done. I know that there's being research done internationally currently, so we'll know more about this as time goes on.
Great, thank you.
Thank you.
So for more information, or if you would like to schedule an appointment, please contact us by calling 631-265-8780. And thank you so much for taking the time to talk to me.
Thanks so much.
Appreciate it. Thank you.